This is a moment of excitement right now because I'm going back home. I just want to take the opportunity to thank everybody, every nurse, all the nurses, those who have left this place already. I think I can remember their names, but I don't know their faces. Some are there. They have been close to me, though that gap. They have been singing, can you imagine my RCC? Can you imagine?
Ku Masani Media olunaku olwaleero ab'obuyinza mu kibuga ky'Embale basiibudde abantu abali mu 10. Etukidde olunaku olwaleero ng'abantu 10 basiibuddwa okuva mu bifo by'okweyawula oba bimanyibwa quarantine centers, era ng'ensonga ya kirwadde ky'Ebola. Ekirwadde ky'Ebola kyalangirwa gye buvuddeko minisitule y'ebyobulamu tekyakiyingidde mu ggwanga lyattu Uganda, era ng'omuntu omu yakakasibwa okuba nti yafa ekirwadde kye kimu, era ng'abantu bano abadde mu karantini okumala ennaku 21 beebo abakwataganako n'omugenzi eyafa ekirwadde kye kimu, wabula ng'olunaku olwaleero bamaliriza ennaku zaabwe 21 eza akuva ku olunaku olw'ebbalaza olw'okubiri n'olw'olwokusatu bazze bamaliriza ennaku zaabwe 21 ez'okubeera mu kweyawula kiyite karantini, era nga bano basiibuddwa okuba nti badda maka gaabwe era nga basobola okwataganako n'abantu. Mu bufuwe bumu ab'obuyinza bakubiriza abantu nti okusiibula abantu bano okuba mu karantini n'abalala abakyasigaddemu abatonotono tekitegeeza nti ekirwadde kino kiwedde, wabula bantu kubanga bongera okwekuuma n'okuba nti beebeereramu ng'enjogera ennaku zino weeri okusobola okulaba nti ekirwadde kino ate tekiddamu kujojobya bannansi naddala Mbale okutwalira wamu oba n'eggwanga okutwalira wamu. Byonna tugenda bikutuusaako ng'embeera bwebadde mu kusiibula abantu bano.
I don't know if this is the right time to say all this, but as a teacher I can't lack words. And this is a moment of excitement right now because I'm going back home. I just want to take the opportunity to thank everybody, every nurse, all the nurses, those who have left this place already. I think I can remember their names, but I don't know their faces. Some are there. They have been close to me, though that gap. They have been singing, can you imagine my RCC? Can you imagine? They could come and sing for me. I just want to take this moment to thank Atone, to thank Atim, to thank my Ayot, and others, you know. I don't know, you have not opened up. Others could come and tell me, I'm Tim, you can see me. I'm Tony, you can see me. So others have been my friends, but I've not got chance to see them physically. I can't forget Sam, who is next to me here. Thank you so much, all of you. Like I said, I'll not say a lot, but I don't want to forget that I've been in a tough moment. First, I lost my dear son. I lost my dear son, where I invested everything in him. I wanted him to be a nurse. I wanted him to make a good family. I wanted him to do anything for himself. So I can't say I'm sorry for those whom I didn't treat well while I was being brought here. I'm very sorry, I apologize. You just picked me the way we were picked. I thought we were going to die too. The situation was very terrible for us. I can't believe. But suddenly, I'm here now. I want to say I'm grateful. And I thank God that all is well. After receiving the news that I had been declared safe, I thank God for that. I thank you for all the efforts you've put in to see that I survive this with my family. All my family is here. I'm going home now, but I'll be there alone. I'm going to be there alone. I was worried for my school, but the DO did everything, and they had to put some rescue team, and the school is going on, and some people went there and they told me they are okay, the school is running well. So I'm very grateful. I don't want to say a lot because like right now I'm lamenting. I can't.
The leadership here, we thank you so much that you have come to jubilate following the outbreak of Ebola, having worked tirelessly. Thank you so much. Special thanks goes to the Minister of Health and the team. I think this was the best response we have ever had. One, because before the results were released, we already had the DG in Mbale Regional Referral Hospital. Actually, it was in the meeting that we were debating whether to say we are sorry for the results that have come that are negative or they are positive. So the breaking of the Ebola results was done by the DG when it's already in the Regional Referral Hospital with the staffs. Let's clap for the Minister of Health team. And following that, we continued with our work. I would like to take my special thanks to administration of Mbale Regional Referral Hospital and the staffs. Despite the hardships that we had, services continue to go on in the hospital. Let's clap for ourselves for that. In a special way, I would like to thank the whole team here, the response team that is here, and all the pillars, because it was your unity that has given us success today. The pillars in here, all of you have done tremendously well. I appreciate, and as a hospital leader, I appreciate each and everyone. Thank you very much for your work done. Special thanks goes to our IPs that have been here with us and have supported us here. That is WHO, we thank you so much. UNICEF, IDC, MSF, Baylor, UHA, and Oxfam. In the record time, in the 21 days, we had about 128 people, but we were able to discharge 18 yesterday, but we discharged 26 yesterday, and today we shall be able to discharge 56 people. And these are people who have now survived and are going back to their communities. So we appreciate you for the work, but we again call upon the community members that these are now our own people. They have survived and have healed. Let's welcome them into our homes, into our churches, into our workplaces, because they are now fine and they can be with us. Finally, I would like to recall and maybe ask the leadership of Mbale City and the leadership Madam RCC and the RDC that the center that you have set here as the ETU, our humble request and prayer is that this remains as our isolation center from Mbale region. We have had many outbreaks. We're all aware of cholera. We have had the mpox is around, but we have had challenges where to isolate them from. So the prayer is that if what we have set in is now can be sustained and maintained under your leadership, that this becomes the center for all the eastern region for isolation.
This is not the end of Ebola declaration. I see everybody happy and excited. This is the 20th day into our response of the 42 days. We are 20 days out of 42 days. So as we celebrate, we are in the middle of the journey and we continue to move this journey. Allow me, guest of honor, to thank the people of Mbale. All the people of Mbale, clap for them wherever they are. We have met a community that was able to be receptive, to understand, and fight Ebola in the record time. I want to state very clearly here that all the Ebola patients have recovered. This is the second occasion following yesterday's occasion, which was honored by the Honorable Minister. And all by today, all the positive cases are all negative. They have recovered and they are going home. I want to state again, and our guest of honor will state this further, that all the contacts in Mbale, by the end of Friday, we shall have most of them back at home. By now, by the end of today, I will have at least 85% of them going back to their families. They are safe, they are okay. Hug them, and if you are hugging, they are okay, there's no problem. Please accept them and use them to spread the message as we continue the next 21 days.
Members, firstly, it is a honor to be with you, but most important of all, that we have discharged our friend. Us who were here when we got that index case in Mbale Regional Referral Hospital, it wasn't an easy task. The moment the case was confirmed, actually it was an evening, as I was moving into the gate, I see the Director General in Mbale. I'm like, has he come for the usual supervision that they do? All of a sudden they called us for a meeting, and in the boardroom, that patient so and so was found to be positive for Ebola, and unfortunately he passed on. But the key issue was he passed through casualty unit in Mbale Regional Referral Hospital. And you know what happens in those emergencies? Seniors pass there in the morning, they pass there in the evening, but in between, our intern doctors are on duty and the SHOs are on duty. And this is what happened. About 4 or 5 people had come into contact with the patient. So the following, what followed after was marked isolation of whoever was in contact with the patient. It also came at a time when we had some glitches within USAID, and which we pray that they get solved. So what are the implications? That our HR staff was markedly reduced in the Department of Internal Medicine, and to add on that, there was marked anxiety within the Department of Internal Medicine. And I'm glad to say that we are really thankful to the Ministry of Health. The following, I think, was it after 1 day, 2 days? The convoy from the Ministry of Health was here, and that was the biggest boost to the team. Otherwise, every malaise, everyone was complaining, have I developed Ebola? Because we didn't know who was in touch, who touched where. Sometimes it is very hard, who interacted with who. And then the next episode was to assure my team that was in the isolation unit that actually you're even much safer that you're being isolated. But us who are here, we even don't know, but we are just roaming around.
Previously, our patient, who I will not mention by name, and now a friend and maybe a client, we appreciate your calmness, your understanding, your cooperation. Many times we go for people, we bring them here, we've had people jump and go away. Our patient has remained calm throughout the whole period of admission. She has remained calm throughout all the challenges she's faced. So for that, we really thank you very much. And maybe lastly, to all of us, we say this battle has been won. Many battles have been won before, and many are still to come. So the struggle continues. Let's always stand up whenever we are called to come and respond. Thank you very much, Mr. Chair.
Thank you. You didn't introduce yourself.
Despite the fact the MC introduced me, yes, I'm still maybe required to introduce myself. I am Dr. Musoke Tone Sechkongo. I'm a physician in internal medicine, and here I act as the ETU team lead.
thank all the team. I want to thank task force team of Ebola. I want to assure the Ugandans we have been working together as a team with my comrade RCC of Mbale City. You see, Ebola is not easy. Even me, the day here Ebola is in Mbale, I feared even to come to town. But I tried to be in touch with my sister and my colleague. He said, no, we can fight Ebola. And I want to assure you, I want to thank the Ministry of Health. You people, you managed to come here to give us the full support. I thank members. Let's clap for the Ministry of Health. I want to thank the management of Mbale Hospital. We have been working together, Dr. Mwayafa and your team. In the behalf of the Office of the President, we are very happy. And normally for us, we always send the messages, reports to our bosses. We send daily, how is the report of Ebola? We have been sending, at least for now, I'm very happy when I hear such a news.
I want to thank God for this day. This is the day that the Lord has made, and therefore we should rejoice. When Ebola hit this country, and the first person or the person who first died was buried in Mbale, it sent shock to the community of Mbale. It sent shocks to all of us. But I want to thank the Ministry of Health that sent a team under the commander called the IC, Mr. Kajirita, Doctor. You are wonderful. You are a force to depend on. And there is no doubt that the government had to make you the incident commander of all outbreaks, especially Ebola. I heard of your history. You have been managing Ebola in Congo. You have managed Ebola in Uganda, Muvende. You have managed Ebola Sudan, the one of Mbale, the fastest response that we have had in the whole country. I thank you so much for your commitment. Today is the day to appreciate all of us for our efforts. The task force, wonderful team. All the pillars did their work. And they did amidst very less supervision, amidst lack of funds, amidst lack of even water. We began taking water the other day in almost the last task force, the most recent one. But the team was committed, it was on ground, psychosocial, RCC, E-team, all these teams, the coordination team, we were all up to task to ensure that Ebola is fought out of Mbale. I thank the community of Mbale. They had the message. They were giving us alerts every when they could suspect. The worst alert that got me almost out of my home was that one of Kasanja. It came in a very hard manner. The community was like, come and pick your body. Ebola has come here. Please hurry. For us, we are dying. That was the most hard alert that I received. But you people managed to contain the situation. Business continued to be normal. Our children are at school. Those who enjoy night clubs have continued enjoying. But we encouraged them to maintain the standard operating procedures. I thank you so much. The frontliners. There was a time I came here and I found you in jackets. Are they called jackets? Overalls?
Yeah, coveralls.
All from the head up to the feet, covered under this hot situation. When the people of Mbale saw you, they said, yes, Ebola has come. But you could not fear. You said we have come to ensure that we treat our people. We thank you so much. You are our heroes. Now to the institutions that accepted to quarantine our people. Once you hear that someone is either a suspect or a contact, there is that natural fear. But the institutions accepted and received our contacts to quarantine them. We have hotels which are hosting our people. We have the schools. Some of the institutions of learning here have quarantined our people. And today is when we are getting out a bigger number of those that were quarantined. Like Dr. Mayaf has said, the first day we discharged 18 people. Yesterday we discharged 28 people. And today we are yet to discharge 56. But why are we doing this mini ceremony? To say thank you to all of us. Because it was not easy. Psychologically, mentally and whatever, it wasn't easy. Our mama, we thank God and congratulate her. And thank the professionalism that the doctors have exhibited. We could only hear we have 7 positive, we have 128 contacts, but nobody, I'm very sure, knows these people apart from family. The information has been professionally managed. And it is today that I am seeing our former patient. I did not know her, but I heard that there was someone whom we were treating. So we want to thank you and ask you to maintain that level of confidentiality and professionalism in doing your work. The Office of the President is happy with the team. Yesterday I received a call from the Minister for Presidency asking me about the situation of Ebola. I told her things are under control and our people are getting back home. So that means the President as well is aware that we have managed and in the fastest way possible. We thank all of us. The IC, I want to ask that God adds you more years to continue commanding. You really command. The first task force was like a quarrel. It was like, you people, you are here seated, things are worse, what? So everyone woke up by themselves. I thank you for that command that you exhibited. For us, we shall continue holding the task force meetings. We shall continue using government airtime to sensitize our people. Congratulations. Some music, please. We are jubilating. We have won this war. DJ.